Welcome to Medical Intuition Illuminated, the podcast bringing light to the wisdom of the body. I'm your host, Laura Wise, a medical intuitive and psychic medium dedicated to helping you understand the subtle and layered ways your body communicates. Here, we explore the meeting point of intuition, physiology, and energy, approaching the body not as a puzzle to fix, but as a wise, expressive system that's always speaking. This podcast is for informational and educational purposes only. It is not medical advice, and it does not replace professional healthcare, diagnosis, or treatment. Always consult a qualified healthcare provider for any medical concerns. This episode contains a real medical intuition session. All participants are anonymous, and any identifying details have been edited out to protect privacy. Welcome today. So before we get started, I just wanted to let you know a little bit about kind of work that I do and give you some idea about what to expect from the session. So we'll be taking a look energetically at your body in the different areas. However, I'm not a licensed medical practitioner, and I want to be clear with that and say that I will not be diagnosing. I won't be saying that I can cure anything, and I won't be having any named conditions or disorders unless it's something that you bring up that we want to look at energetically. Okay, what we will be looking at is the energy of the different areas of your body and how they're operating holistically and individually. And so before we get started, do I have your permission to read you and your energy and your body today?
Yes, thank you.
Okay. Beautiful. So let me take a moment to go ahead and reach out my energy to you. I'm going to start at the top of your head. A lot of the information that comes through initially is really kind of how your mind works and sometimes also how you receive intuitive information. The first thing they're showing me is just you have an incredible, almost like technical mind. They're showing like gears turning, and that you're really good at like problem solving and figuring out problems and kind of thinking through them, and the process of the problem solving is really like very enjoyable for you as well, and just you're very good at it. You're kind of always thinking through things. Does this make sense to you? Yeah.
Yes.
um, I do see that sometimes you do get some pressure through your head, some sinus pressure as well. And that might be, let me feel if that's more acute. It does feel a little bit acute at this time, but it's something that kind of can be ongoing for you. Have you been experiencing anything like that recently with kind of some pressure through your
No, not so much, but I will say that yeah, my head and my brain um is yeah, just kind of clogged often.
hmm Yeah, and it feels almost like I would say kind of what I would think of as dry pressure than it being wet pressure. So it kind of feels like that. You might get like tension headaches from the dryness and the inflammation that comes along with it, rather than it being like if it would be stuck mucus from that kind of dryness pattern. And I am sensing a bit of a dryness pattern throughout, although it's not in every part of your body. So we'll get to that when we look at your digestive system a little bit more. Um, and I do see a lot of tension that goes down the back of your neck. They're showing me that you've been sitting, if sitting a lot recently as well, and kind of like looking down. And so that's part of it is just that holding, but you're also holding a lot of mental and emotional energy in your neck area as well. And just tension, they're showing that go into the shoulders as well. Um, and the way they're showing it to me is that you really you care for a lot of people and you carry a lot for a lot of people in a lot of ways. And I think even more than sometimes you let yourself realize that you're holding for others, because it's like there's a part of you that is letting it go, and then on the back burner, you're kind of continually kind of holding that. And, um, looking at your throat now, and I do see you have an incredibly strong voice, an incredibly, like, very clear communicator. And that's something that you deeply cultivated through your life is like being able to say things in a specific way so that they're understood simply and clearly. And that's a really beautiful thing. Um, but I'm seeing again a little bit of dryness through that throat pattern as well. Um, and a little bit of just soreness within the throat. Um, you don't have a lot of tension in your jaw. I often see that with people, especially with the neck tension, but I do think that that's something that you're um, able to work with, that you've kind of help keep that not feeling as tight. Good. They're pulling me down farther into the body, so let's look into the chest and the lungs. They're pulling me into the lung space. So again, I'm seeing that dryness pattern in the lungs as well. Um, we see the lungs govern the emotion of grief. It's not a grief pattern per se, because I feel like you're good at moving those through your body. Um, the way they're putting it is almost like world weariness and then a grief for the collective, a grief for the experience of humans, and particularly like in this challenging time. This makes sense to you that kind of carrying, and again, this is moving into the tension that's in your neck and your head, is kind of you feel things so deeply and you don't turn away from suffering. And that is a lot to carry as a person in this world. Um, and it makes it hard to catch a breath, is the way that they're bringing it through. Is
Mm,
that it just feels like it's coming and coming and coming. You're really good at addressing your own physical health and keeping your own body, but it's like all these things that are outside of your control that just feel like they press in heavy on the chest. This makes sense to you.
mhm.
Um, so it's like, it's not necessarily personal grief that I'm seeing. It's this like really big collective grief. Um, and the way that they're putting it is that you, just by feeling the grief, just by experiencing it and being witness to it, that is doing a lot of good in the world, even though it's challenging, right?
Mm.
To have it be felt and moved through and not held personally, because I think some people look at the collective grief and they almost like personalize it into themselves. But for you to be able to hold it and look at it outside of yourself, you're actually having a lot of impact in that way, and in impacting the collective, and even though it's really challenging. Does this make sense to you?
Yeah, thank you. That's nice reflection to hear.
Hmm. Okay, let's look at the heart space. And I am seeing some interplay between the heart and the lungs as you kind of process that. So the way they're showing it is you it comes through the lungs, and then it's almost like you push it into the heart and you feel it in your heart. You really are feeling that process and feeling the experience of being human, and then it's kind of like creating a conversation between your lungs and your heart in this really beautiful way. Um, that is part of that processing that we talked about that you're doing. And you have such a very big, powerful heart that is just really, you really are able to hold people. They're showing me that you're able to hold space for people in such an incredible way that you're a great listener, right? So you listen without the need to kind of interject or respond necessarily, and let people kind of unload their heart. And they're showing me you make space in your heart for them, and that is really incredible. Because I think a lot of people, they think it has to be a back and forth, and you understand that it doesn't, right? That you don't have to be participating in somebody else's experience of right? You can just be allowing, I guess is the word that's coming through. Let me see. So I do see on the left side of the heart, they are showing me there's a lot of things that you keep very private. So that shows up a lot of times as kind of like when I see a black energy of the heart, it's like protective energy. It's not a negative thing. So it's showing me, and it's specifically just on the left side of the heart. So there's a lot of things that you keep very close to yourself around that. A lot of emotions that you only share with yourself around things. Um, and there's a certain relationship dynamic, particularly in your life, that's happening and unfolding, and there's a lot of things that you're keeping very private about that relationship that's happening. um because you feel like if sharing the way it's coming through, it's like if you sharing it won't do any good to the experience and the relationship. And um, but it's hard to keep all of that inside, right? It's hard to not be able to bounce that back and forth. And so let me feel into that a little bit. It's the relationship is very complicated. I'm feeling that right off the bat, and that there's a lot of exchange around give and take that is complicated around giving energy back and forth and having things being reciprocated in the right way. Does this make sense to you? It
Yes.
seems like you know what I'm talking about.
Yes.
And the word fairness is kind of coming up as well around that. And this is yeah, I'm just feeling it's so much complicated energy around it. I'm trying to feel into where exactly, and it's on both sides, feels really complicated. Because there's a lot of like missing miscommunication, right? Saying things like crossed wires, something gets said and it gets misconstrued on the other side on both directions, right? And it's almost like it takes so much energy just to get to the same place of clarity and communication that it's like by the time you get there, it's like, oh, why bother even kind of doing anything with like what we finally agreed. Now we can't like even move forward from here. We finally agreed that we're talking about the same thing, but we can't agree even on that. And it's a lot of, yeah, and it is weighing heavily on you because I see that you like to have very clean relationships with people, really clear exchanges of information. Um, this is what we will are going to work on in the healing portion as well as this particular area in the heart space. So we're going to look more deeply into that when we get to that section. But they brought this up a couple times of that it would be good if you have somebody that is a neutral party to talk to this about. So I don't know if you already have somebody like that in your life, but somebody that you can really yeah, because it's almost like you've been so careful with your words that it would be good for you to just vent and say all the things that you think are quote unquote terrible things inside you that you're thinking, right? That your natural human responses to have some to be able to share that with somebody and get it out of the body, right? Because you're trying to be so fair and balanced. If this makes sense.
Feels like a good homework assignment.
Yeah. And we'll see when we take a look at that, uh what else we can provide there during the healing portion. All right, so let's move on from the heart. You know, they're pulling me into, is that the left shoulder? Yeah, they're pulling me into the left shoulder area right here. It almost feels kind of like an acute injury that's become more chronic over time, and it feels really deep into the joint there in the front, almost in the front part of that joint, in the socket. And yeah, they're also showing me that sometimes there can be some kind of like tingling or numbness or pain that goes down that left side of the arm. Does this make sense to you?
You know, it's interesting. I've had this happen with other intuitives. It's a mirror. It's my right.
Oh, you're right. Oh, that's so
Yeah.
interesting.
Yeah, but
Yeah.
it's definitely across the top and into the joint and
Mhm.
old injury. This one, the left is tight, but
Yeah.
this is where the right is where the kind
Hmm.
of I wouldn't use the word pain, but it's just like yeah, low level stuckness
Kind of
and
like, yeah,
yeah,
almost like irritation or something that
yeah,
goes there. It's interesting that it was pulling me to the left because I sometimes do see that with one injury, right, the other side ends up compensating
yeah,
and kind of carrying some of that as well. So I could see over time, oh, they're showing me that goes with the tightness in the neck that we were looking at
yes,
earlier, that is connected to it within the shoulder area
that
there as
makes
well.
sense. Yeah,
And that, oh, you've had to kind of like, you had to really baby that arm when you were healing from this injury, and it kind of reshaped the way that you're holding those bodies and those shoulders
yeah.
um, as throughout time, right? And the left one had to do a lot of heavy lifting. This is interesting. The left one feels like it would like some appreciation and thanks for carrying the weight of the other one, which
Mm,
is interesting. that it feels like it, it kind of like really put itself out there to work extra hard.
Yeah.
And so it would like some recognition for that. So maybe when you have a moment, you can, another
Hmm.
little homework is you can give it some love around carrying both of those because yeah, it's saying something about like rebalancing that it really kind
Yeah.
of balanced that. And it had to do a lot of work when this whole arm was recovering, right?
Mm.
It had to kind of really step up, which wasn't normal for it. Are you right-handed?
Very.
Okay,
Yeah.
yeah. So it had to really kind of pull extra weight that is not used to. So that's interesting. You feel into that injury. Yeah, it's mostly healed, but yeah, especially like when it will get colder in the winter months, it will kind of start to um, go up again. And when there's more of like dryness throughout your body that's happening, it will start to have pain as well with that. But um, and I think that often you try to really just push through, and you're like, it's fine, it's fine. But allowing it to kind of even just tell you that it's aching sometimes can be really helpful. Um, I do see that you tend to get cold in your hands as well, and you do get some kind of just tightness from that kind of cold. Your joints get really cold through there and crackly as well. That kind of dryness, cold pattern that we're seeing. Um, you're really good with drinking the tea, though. There's just really showing me your whole body is showing me like you're so good with tea. You just like it's like on tap, basically, is what I'm seeing. Does that make sense?
Yeah.
Yeah. Um, okay, beautiful. Yeah, great posture. I'm looking at your spine right now, and I just feel like that's something that you've also really cultivated is having posture. Do you have some kind of practices around stretching
I
or?
wish I did more, but I teach Qigong twice a week and
Oh,
always do the spine. And yeah, if
yeah.
I didn't
Okay.
teach, I'd be in trouble.
Yes, it make that I can see that now. That makes a
Yeah.
huge difference for and for the lymph they're showing me as well that just those really soft movements are great for just keeping your lymph going because you know you do run dry. Um, I do see again, we talked about sitting a little bit, so I'm seeing a little bit of compression in the bottom part of the spine into the hips area, and just that
Yeah.
it's yeah, there's been maybe especially this last few days, there's been a little more sitting than your body would prefer. Um, okay. So let's go into some of the organs in middle. I'm looking at the kidneys right now. They're very, very happy. They have really great. They're singing to me, which is so interesting. They're just like
Hmm.
humming. They're just telling they're working real well. Your adrenals, just again when that we talked about this like greater grief of the world, that can be really taxing on them. But they are showing me that you've gotten to a place where you've really figured out kind of life balance and flow balance and work balance. And you have so many tools for when you do get really stressed out, you know exactly what to do to bring yourself down. So they really want to thank you for all the work that you've done in cultivating just a balance with your systems and your hormones in that way. Um, And for generally being a dry patterning, you're very well hydrated. So I don't have to tell you that. Um, okay, so let me look at the stomach here. So stomach does run also cold, which is unsurprising since we're talking about that pattern. So and it feels like it's a lot of times in the morning, it's hard for you to get hungry first thing in the morning. Sometimes waking up that stomach takes a little bit of time. But the tea drinking is great. Again, it's like the first thing you have in the morning is tea.
Coffee.
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 Got it.
Yeah.
Hmm.
Yeah.
Okay. And that does definitely play into the dryness, but coffee is, can be life sometimes. So, um, I do find with that dryness pattern, a lot of times if you can eat a little something before having the coffee, it can really create kind of keep the stomach from going cold too quickly and kind of shutting down with that acidic kind of response to it. Um, because it's about kind of building up that digestive fire, especially if you have a pattern of cold. In Ayurveda, they often will recommend having a little bit of something sweet first thing in the morning because it starts the digestive fire before eating anything. Um, do you feel like you have, yeah, your stomach wants to thank you for your attention to your diet? They are saying something about, it's holidays, right? So there are some things that maybe it was, that are not ideal for you, but you're having them because they're enjoyable for the heart and the mind, right? But generally you know how to balance that when you have other things. You're like, oh, and you kind of can put boxes around it to have it be really well maintained. Let me see anything. So let me look at the digestive pattern. Yeah, so digestion tends to be slow as well and cold. And with that, right, it sometimes things can sit in there a little bit too long with cold. And there is some gas and constipation that comes along with that. Um, yeah. And do you ever do ginger as a part of your regular?
Yeah, it's interesting. Right now I'm having some well, I mean it's kind of an ongoing thing where I get really tender gums.
Oh, interesting.
Yeah, it's I don't know. I've had it for a long time. The dentist thinks it's what'd she call it? Lichen sclerosis.
Mm,
Anyway, it comes and goes, and it tends not to like kind of the hot like
mhm,
ginger
mhm.
or too spicy
Okay.
or tomatoes or things like that. So I
Mhm,
kind of I definitely do ginger, but like really watered down.
mhm.
Yeah.
Yeah, one way that's really nice to have it is just like slices of ginger in your water, and then
Yeah.
it's kind of you're not getting a lot of it. And again, they're showing me almost something like within like a smoothie would be too cold. I wouldn't recommend that, but something like
Yeah.
if you had a warm smoothie with oats, or if you made like oats with ginger in it, I feel
Okay.
like that could be
Yeah.
a really good way because the warmth is really good too. But I understand about the kind of spice. It's like getting it past that point in
Yeah.
your body.
Yeah.
Um, and the other things like even like cinnamon might be too spicy for your gums, right?
Yeah.
Yeah, cinnamon and other
Yeah.
things that would be warming like that. Um, just feel into that. Yeah, because I just feel like that getting that section warmed up a little bit with food could be really helpful for moving some of the stuff through.
Yeah.
Um, that let me just take a look at the gums because
Okay.
we looked at the jaw, but I didn't look quite at the gums and
Yeah.
see what's going on
Yeah,
with.
it's the tongue and it's just little patches in the gums.
Mm-hmm. Mm-hmm.
But like even right now,
Yeah.
my tongue actually hurts like a little bit, like 0.3 on a scale of 0 to 10, but it's
Hmm.
just unusual.
Yeah, it feels partially linked to this dryness pattern that we see without, but it's having a kind of expression, the different like a different inflammation expression within the
Yeah,
gums than elsewhere. Um, I see you're changing all your stuff regularly, so you're keeping that clean, so it's not an issue of like bacterial, like excess
yeah.
bacteria, right? I see that you're taking care of that. Um,
Somebody
mhm.
suggested like drinking aloe vera juice or trying
Aloe is
that.
really cold. So it's energetically
Interesting.
one of the coldest and it's
Yeah,
really hydrating, but it's
yeah,
super duper cold and it's so if you already run cold and your digestion like in the middle of the summer, you could probably do it in the middle of the day.
yeah.
But
Good.
right now it would like just shut your whole system down even more. So I
Yeah.
would almost say something like they're actually showing me like a salt rinse, doing a salt
Okay.
rinse on a regular basis, or even
Yeah.
something like I know it has this is, determine this of your own feelings and, obviously follow your dentist recommendation, but, like something like colloidal silver or something as well, like a rinse
Okay.
inside. I know that has
Yeah.
some people feel strongly about that. Um, yeah, I just feel like it's almost just needs like extra rinsing on a regular basis.
Okay.
Yeah. Anything else in there? Yeah, it's just like kind of a dryness inflammation pattern through there. And it's painful because it's inflamed.
Yeah.
Um the stuff on the tongue feels like it is connected to the digestive. slowing down as well. Because there's a little
Oh,
bit of
interesting.
like malabsorption that's happening in the because
Yeah.
things are sitting for so long. And sometimes not getting hungry as well, right? So it's just um yeah, you like feel fuller than when you're actually full is the way that they're showing it to me, is that you kind of get
I think that would translate to being bloated.
mm-hmm.
I
Yeah.
almost always feel hungry.
Mm-hmm.
I like being full, but
Mm-hmm.
yeah, I often get like really bloated, and I can't pin it to a certain food.
Mm-hmm. It's yeah, it's more, it's not necessarily a certain food. It's more about kind of like prepping the digestive system for kind of being able to break things down. Because again, it just
Yep,
goes really cold. And that
yep,
coffee the first thing in the morning is kind of like it freaks out and it gets like inflamed from it a little bit. Do you have it?
yeah.
Do you put anything in it or am I seeing that it's black
Cream.
cream? Okay.
Yep,
Um, Yes, the cream does soften it a little bit, so that does help.
yeah.
But yeah, I think if you had a little something like a sweet flavor, something to pat it with, or like, do you ever do, they're showing me dates. Do you ever do like dates or some kind of like a dried fruit even in the morning, even though it is dried? Um, stewed,
I could try like a prune.
yeah, like a,
Yeah,
if you've ever made stewed prunes, they're like real delicious. You just kind of boil them in the morning with
yeah.
some. And that might be a way to get that ginger in too. In
Oh,
the morning,
nice.
right? You could do some warming spices and the stewed
Yeah,
prunes on top of some oatmeal.
I like that.
Um, yeah. Um, okay. Let me look at the other. We're down into digestion. Yeah, because it's really, it just sits there and kind of ferments. So I would also say like for greens, like raw greens and raw vegetables are really tough on your digestive system
Yeah,
because they run cold. So again, everything cooked really well. The cabbage is coming up is really great for you in particular.
yeah.
I know
Okay,
it can be gassy for some people, but it's that fiber, right? And that fiber is going to really help. Um, they're just showing me fiber all around, both insoluble
okay.
and soluble fiber to kind of help move things as well. They're telling me you know exactly the fiber sources that you need
Yeah,
for, yeah, that's familiar. It's almost like you used to do it a lot, but now it's dropped off a little bit, and it's a reminder to kind of increase those. Um, and they're also showing me just warming up your belly, like with some heating pads and things, warm baths, just really like bringing as much blood flow and warmth to that area as possible. Uh,
okay.
yeah, because yeah, it's also coming through that gums, right? And particularly the tongue on the side of the tongue, like you were talking about. Um, look at liver. So liver governs the emotion of anger, and you have a really beautiful relationship with other people's anger. You're able to let them kind of like have their experience of anger right there. When it comes to your own anger, that's still something that you're learning how to hold in a lot of ways, right? And you've gotten to a good place with it, in that you understand it intellectually, but sometimes you will still bury it in your body a little bit, and with that it's yeah, they're showing me some that it in a lot of ways in your past it wasn't really safe to express it fully. And so you've gotten really good at kind of transmuting it into other things and like I said, intellectualizing it and moving through it in that way. Um, and it's giving yourself permission to feel that anger sometimes. And they're bringing this up in relationship to what we talked about with your heart space as well. Because there's some strong feelings of anger around the relationship and the experience of it. Um, and that again, this is like where the venting comes in. We talked about is just really even being able to like verbalize the anger that you're feeling because you've been so cautious about doing that. Does this make sense to you?
Yes.
Yeah. Okay. Is liver also what we're going to work on? Yeah, so that's what we're going to work on as well. So we have those two things. Let me just take, for time's sake, another quick pass and see if there's anything else we want to bring up before we move to the healing portion. Showing me the left hip joint,
Hmm.
the left hip
Yeah.
being particularly painful. It's beyond, it's like sciatic, but it's deeper even into the kind of bone area. Um, does this make sense to you?
Yeah, that's like really, really old. It's not bothersome, but it's
Okay.
there. Yeah, I mean, it doesn't restrict me from doing anything
Hmm.
that I
It'll pop
want.
up. It pop-ups every once in a while with just kind of a little
Yeah.
pain notice. Yeah.
Yeah.
So,
Yeah.
so your body's telling me that that is a signal again that you're like doing too much and you're overgiving
Okay.
yourself away. So when that's coming up, it's a little signal to slow down. Um, yeah, and it's showing me kind of when we talked about the shoulder thing, there were some balancing things that that hip had to do while that process was happening as well, connected to it. All right. Was there anything that I didn't get to that you particularly wanted to ask about?
Um, well, I mean, the what was on my thing was the digestion, which we went into the mouth, and then I feel like so years and years ago, I had an MRI done on my brain. They were
Mm-hmm.
looking for something and they didn't find it, which was good news, but they did find a benign tumor
Mm-hmm.
right kind of at the crown. And it's small, it's about the size of a pea. And skin cancer, squamous cell skin
Mm-hmm.
cancer. Again, right? So I have a tumor here, and then I had a squamous cell here, right
Mm-hmm.
on there. So they were able to take it out and put a bunch of staples in, and it's healing. But it's kind of like this area, like bringing it up and bringing it down, and the
Mm-hmm.
circulation. And so, kind of what you were talking about with the tight shoulders and tight neck. Yeah,
Yeah, goes through kind of that whole energy system there. Let me take a
yeah.
look at what's going on there. Um, and I feel the concern that you have around it too. Yeah, I'm just feeling into that. And that's kind of feeds into what's happening there as well, right? Yeah. Yeah, this is something that is kind of like almost something an energy thing that you came in with a little bit around.
Mm.
It almost feels like a past life kind of experience that it's connected to. Um and that part of, oh, that's so interesting. The way they're putting it is that you are so incredibly powerful with your crown and your ability to connect that it almost is in its own way a protection from
Mm.
keeping you from just kind of like blowing that out and just constantly being connected. Oh, I'm getting the chills right now. This is important to say that it's that in a way it's kind of kept you in your body in a way because you have so much intuitive ability and but you came here this time to be in the world because it's almost like in this other lifetime you were always connected all the time and it was almost to the point of madness right in its own way right it was almost to just like constant information is overwhelm and in its own way this thing has been almost a little cap on your energy to keep you here and now to be able to do work in the physical world and channel the energy back out through your hands and your body. Does this make sense to you?
Yeah, yeah, it makes me cry actually. It's like
Oh.
just several things you've mentioned of like just this kind of like grief about being human. That kind
Mm.
of
Hmm.
ties into it.
Hmm.
Yeah, yeah,
Yeah. Yeah.
yeah, yeah.
Um, Let me just take a look at that. They do it is, it is benign. You already know that. And they're not really saying to do anything about it. You're caring for it really well. Um, the bleeding was just kind of the skin reacting to that being there. Um, but it is again something that is kind of almost necessary for this life in its own way, right? Um, What do they say? They're almost just saying, do you ever wear hats?
Yeah,
Okay. They're almost talking about that as just kind of just an extra little kind of keeping it. It's almost like it wants to be warm, like it
yeah,
gets irritated when the cold and the wind.
yeah.
And so kind of keeping it warm and protected is going to like keep it from getting dry, and then the dryness causes inflammation, right? And
Okay.
that's kind of what was going on with the bleeding is it got kind of too dry in the scalp. Um, and they're saying something about one of the shampoos that you're using right now as well as being a little bit irritating to your scalp.
Oh,
So,
interesting.
so that might be something to kind of investigate with
Sure.
um, that as well. Um, but I'm not seen as being, yeah, it just, and it feels like it just I don't know, it gets like itchy, it just irritated sometimes, right? And that's bothersome. Um, okay. Did that answer your question?
Yeah, thank
Okay,
you.
beautiful. All right, so let's go ahead and move into the healing portion. So we were looking at the liver and the heart space. So let me see which one they want us to work on first. Okay, so they're saying liver first. Following the assessment, we end the session with a healing where we unpack the root causes of the stagnant energies that were surfaced during the walkthrough of the body and systems. The information quickly gets very personal and detailed, so in order to maintain the privacy and anonymity of my participants, I don't share these sections on the podcast. They're also not ideal for an audio format as they often include long stretches of silence while we work with visualizations, meditations, and other kinds of energy work. Thanks for listening to Medical Intuition Illuminated. If this episode resonated, be sure to subscribe and share it with someone who might benefit. Special thanks to Derek Ryan for music. Until next time, listen deeply to the wisdom of your body. So I can